Hello, I'm Dr. Mike, and I'm here today with one of my patients, Megan Knowlton, who's 43 years of age. And I've been following her for several years. And she's going to be telling you what it's like to live with Ehlers-Danlos syndrome from childhood into adulthood, and how her many medical conditions have been misinterpreted or unrecognized by the medical community. So Megan, welcome.
Thank you.
So please give some insight as to what it was like as a child and many of your symptoms, and how that related to your schooling and interaction with people in general,
Yeah.
because I'm sure that it was very difficult, especially as a teen.
Yeah, that's when I was a child, I had good friendships. I was very social, outgoing, athletic, everything that a child should be. When I hit probably pre-adolescence, like 11 years old, I started noticing like some social difficulties, but I started also noticing some really weird medical stuff. And my mom was seeing it. Like I would stand up and like have to hold on to a wall because I get really dizzy. And now we know that's POTS, but we didn't know that then.
Which is
And
postural orthostatic tachycardia syndrome, for those that aren't familiar. And basically what it is that when people with this genetic disorder stand up quickly, they feel lightheaded, and can actually collapse on the ground and injure themselves.
which actually happened numerous times as a child. And I learned how to just deal with it without the use of medications or anything. I just know to stand up slowly, to sit down when I'm busy, not to stand too long, things like that. But my mom saw the things too that were going on weren't okay. And she brought me to a lot of doctors in Boston trying to find answers. And a lot of things were thrown around, nothing concrete. And then she brought me to a world-renowned rheumatologist at Tufts Medical Center. And he said, it's time to accept that it's just in my head. So at that time, that's what my mom was told. And honestly, it was probably a lot easier on them to treat that than try to find some mystery diagnosis. That's still very much a mystery, even if it has a name. And I went throughout high school. I had a lot of psych hospitalizations. I was told, you'll never go to college, you'll never graduate high school, you'll kill yourself by the time you're 30, because that's the statistics for someone like you. Well, I beat all the odds on all those, and I'm still fighting, and it does not get any easier. I still fight a lot of stigma, because when doctors don't know what's wrong, they immediately jump to it's in your head. And if I had a legit mental health issue, I'd be okay with that, and I would seek treatment. But nobody goes from needing state level hospitalization of care for 5 years on over 30 psychiatric medications to being on no medications, no hospitals for psych, and working a full-time salary career. It doesn't happen with mental health. Those meds would be needed for life. The symptoms would still be present. But I learned how to behave and act like a good psych patient. And that's what I was treated for a lot of my life. And then one day, my now wife walked into my life, and she taught me I was lovable. And everybody always told me you can't love anybody until you can love yourself. Well, some people have been beaten down so hard in life that you can't love yourself until you're proven that you're lovable. And she showed me that. And I started having a respect for myself, for my life, for my journey. And I think that's actually when you came into the picture. And that's over 10 years ago now. But I had been told about this doctor who specializes in vitamin D, and they couldn't keep my level up no matter what they did. So it was recommended I see you. I saw you, and you called in a bunch of colleagues that day because immediately you knew that I had the EDS, and it explained my whole life. And it's the first time a doctor said to me, this isn't usually the advice we give, but go on the internet, because there's so much that encompasses this disease. And I can't spend all that time trying to explain it. And I did, and it was very validating, but very scary too. Today, my doctors still believe I have a form of EDS. I don't really fit any of the categories very well because I kind of fit all of them. But none of my genetic testing comes back for any of them. But I have horrible vascular issues. You can't put
And,
an IV in me anymore.
and the major form of EDS, of course, is the hypermobility type, which
Right,
doesn't have a genetic test for, and that's
right,
part of the problem.
right.
But I had
And I've
made
also been told I have a form of the classic type
Yep,
that overlaps, but I don't even care what type it is at this point.
right. That's right.
I just want to be told how to live.
Right,
I don't want to have to die from this.
right,
But at this point, my doctors have all given up any hope, and
right,
they don't know what to do. They're at a loss because they don't know what to do.
right.
So instead of doing anything, they're doing nothing.
So maybe you could explain your circumstance right now, because your major issue has been mast cell hypersensitivity and
Yes,
the need for large quantities of antihistamine in order to be able to control it. And that
yep,
often physicians conclude that this doesn't make any sense, when in
right.
fact, this is a very common complication from this genetic disorder.
And that's what I was told today, that it doesn't make any sense because why doesn't epinephrine work? Well, epinephrine is actually very well known for a lot of people with mast cell to not work. I was an admin for a group of over 30,000 members, and majority of us did not have positive mediator testing. And the majority of us also did not respond well to epinephrine. All it does is make my heart race like crazy. The cocktail that they use that is helpful is Solu-Medrol, Benadryl, and Pepsid. And that will almost always stop my reactions.
Yep.
They were trying to order it for home, but doctors can't legally prescribe Solu-Medrol for home use. So I still have my IV Benadryl that I use 4 times a day, which they have concerns about long-term use, but it's literally the only thing that works at this point. My gastroparesis has gotten to a point that I hardly ever take any medications anymore. So anything I take needs to be by IV or through my line, and that's not a lot. So I don't sleep well because I can't take most of my meds. My appetite is very poor most of the time. I've lost over 100 pounds in
Wow.
6 months because of not being able to eat properly.
Yeah. Yeah.
They'll accuse me in the hospital of my wife bringing in food. Yes, my wife will bring in food with the hope of me eating it, but it doesn't mean I eat it.
Right.
So they don't check to see if the food was touched or not. All they know is she brought in food, so I must be fine.
Right.
Problem goes unaddressed
Right.
because once treated for crazy.
Yep. So maybe you could explain a little bit. I mean, to me, it's shocking that you're 43 years old and what position you've been put into.
I'm in a position right now where I'm supposed to decide basically hospice or no hospice.
Right.
Palliative care says they can't do anything for me because my doctor can't order the medications that are needed. And no nursing agency will take on my case anymore. My health insurance, the social worker tried to draw up a contract with an agency they don't usually work with, but I had a connection with that agency. They tried, but they're a very small agency, and my stuff, I agree, is too complicated for them. My airway collapses all the time because I have a floppy airway from
Yep.
the EDS, but also from the tracheobronchial malacia.
Yep.
I was trached for 3.5 years because I had too many mast cell reactions. So they put a trach in me because they couldn't keep intubating me. I've been intubated over 200 times.
Yeah.
Been on life support more times than I can count.
Yep.
I don't know what will take me out. It doesn't really matter anymore. It's important to me that my story lives on.
And I appreciate it very much. And, I hope that that someone listening hopefully can come to your aid and to really appreciate what you've been going through, that this is a major medical condition that needs both thoughtful care and good intervention methodology. So
That
I
means a
thank
lot.
you. Yeah, so I thank you very much for your time, and I wish you the very best.
Thank you, Dr. Pollock.